Hello, this presentation is on nurse burnout and fatigue by Jordan Wardabaugh. The community addressed in this issue is the nursing staff within the Health Services Department at the facility in which I currently work, Dallas Retirement Village. Here's a bit of an overview regarding this community. Dallas Retirement Village was established in 1947 when members of 3 local churches rented a big yellow house to serve as a care center for aging adults called the Dallas Home for the Aged. It is now an urban community located in Dallas, Oregon. Its 30-acre neighborhood consists of independent living, health services, and rehabilitation. The independent living at Dallas Retirement Village offers a wide array of amenities to its residents. Residents can choose to live in either the village apartments, lodge residences, or garden homes, each of which is specially equipped with its own style for independent living. Nursing staff serving residents of these locations may make check-ins as necessary to ensure resident needs are met. The health services sector at Dallas Retirement Village is where we see the issue of nurse burnout and fatigue most largely at hand. Health services consists of assisted living, a memory care center, and skilled nursing. The comprehensive and dedicated nursing services rendered are offered to all residents on a priority basis. Dallas Retirement Village's health services also offer a continuum of care with services including post-acute care as well as short and long-term skilled care. The Rehabilitation Center at Dallas Retirement Village consists of a professionally trained team of therapists, registered nurses, and certified nursing assistants. The therapies offered include physical, occupational, and speech language. The personalized approach offers holistic care to the individual. The focus and goal of the rehabilitation teams is to get you well and home in the shortest time possible. These programs may be offered as inpatient or outpatient services. The patient care structure at Dallas Retirement Village consists of a board of directors, administrative staff including the dean and director of nursing services, resident care managers, the chapel pastor, nursing staff including LPNs, RNs, and CNAs, therapy staff, activities coordinator, as well as volunteers. On a typical day during day shift in the Health Services Center, one would see 3 resident care managers, 8 floor nurses consisting of LPNs and RNs, and about 12 CNAs. The nurse population within the Health Services Department at Dallas Retirement Village consists of both male and female nurses ranging in age from early 30s to late 50s, several of which have at least 10+ years of experience in nursing. A majority of the nurses have either their LPN or ADN. It is required that the resident care managers have at least their ADN, while the floor in charge nurses may have either LPN or RN. It is not mandatory that nurses have their BSN while working at our facility, therefore little emphasis is placed on obtaining this while working here. The nurse-to-patient ratio on a normal business day is about 1 nurse per 15 patients. Dallas Retirement Village's mission statement is that we demonstrate Christ's love by providing a continuum of quality services and care to meet the physical, emotional, and spiritual needs of our residents with dignity and respect. The mission and values are communicated in daily nursing practice with emphasis placed on maintaining the integrity and autonomy of the individual through the encouragement of self-growth and professionalism within the work environment, and by using communication, compassion, caring, and competency in every situation. Dallas Retirement Village does have a religious foundation. Their faith-based heritage welcomes all who may be interested in seeing what this facility has to offer. It is our faith-based, resident-centered approach that separates them from corporate-owned communities as it guides them to continued building a future while honoring the past. Spiritual soundness of the community continues to draw people of all faiths and religions, enriching their lives and providing confidence for the future. Do the facility operations reflect the culture in the community? While occasionally issues arise, as several of the floor nurses feel their voices are not heard regarding staffing dilemmas and work overload related to nurse burnout and fatigue. Time restraints, increased workload, and demand place great stress on the nursing staff. The facility makes every effort to improve the culture within the community. Nurses at the facility greatly affect workplace culture, as jobs can be devalued and when the nurses feel fatigued, overworked, and underpaid. How does the facility implement a spirit of inquiry and evidence-based practice in patient care? Our facility follows protocols and procedures. They utilize cues and core competencies as a standard for organizational growth and patient satisfaction. The issue: nurse burnout and fatigue. Nursing is a stressful profession that can have both a mental and physical toll on the body. When work-related stress exceeds the adaptive levels and becomes chronic, it is given the name burnout. According to Bandera and Figueiredo de Martino, 2016, the term comes from the English terms burning out, meaning someone who does not have more energy. It is the collapse of the adaptive capacity in the individual. It is when they've reached the limit of his or her efforts and it no longer works and they finally become burned out. Burnout saps energy, leaving nurses feeling hopeless. At its peak, it can lead to mental health issues like depression and anxiety. Those who experience burnout often feel like they are no longer able to fully commit to their jobs. This leads to a slow decline, causing some to never return to their profession. Estimates suggest that the nursing shortages will reach 260,000 to 400,000 by 2025. Brown 2018 mentions that nurses are leaving the profession in part because of burnout, which is worsening the nursing shortage. Such shortages have both a nationwide and global impact. According to What Nurses Want, findings from the National Survey on Workplace Climate and Well-Being, released in 2016, almost one-third of nurses have considered leaving their profession due to the rising work demands and burnout. Rising tolls are seen as more and more nurses are experiencing the burden of nurse burnout. According to Fidel 2017, workload was identified in several of the studies as a major factor to nurse burnout. Nursing turnover, increased nurse-to-patient ratios, and inexperienced coworkers also impacted workload. Workload impacts nurses' personal feelings of accomplishment and their ability to meet patients' physical and psychological needs, contributing to burnout. Statistics show that 71% feel they are overworked, 67% listed work intensification as a major issue, and 54% felt reluctant about voicing concerns due to fear of negative consequences. The signs and symptoms of nurse burnout include those that affect both physical and emotional health. These include fatigue, loss of motivation, detachment, reduced productivity, cynicism, and low self-esteem. Burnout is fundamentally different than regular stress. It is characterized instead by feelings of emptiness and desolation. Causes of nurse burnout include unrealistic workload, exposure to trauma, staffing shortages, and lack of recognition. Brown 2018 also mentions factors such as moral distress, poor support systems, bullying, and workplace violence. Moral distress was identified as a contributing factor in the development of depersonalization. Lack of training regarding death and dying, as well as issues with emotional support of patients and families, also contributed to moral distress. Ethical dilemmas is another factor that affects nurse burnout. Limited training and resources may increase stress levels of nurses in difficult situations. Brown 2018 mentions that coworker support may be limited due to inexperience in large patient assignments. While patients need to receive excellent care, healthcare providers also need adequate resources to maintain these standards. Advancements in technology, insurance changes and demands, and the vast amount of new education needed to understand current and expanding treatment and disease knowledge and processes are other causes of burnout. The effects caused by nurse burnout include mistakes and medication errors, absenteeism, resorting to food, drugs, or alcohol to cope, resigning from the job due to inability to commit, and poor patient outcomes. There is a large prevalence of overweight nurses. As nurses attempt to reverse the burnout experience, they tend to use food and other substances to cope in efforts of staying on top of their demands. This can lead to unhealthy weight gain and other serious health problems. Many also find it difficult to catch a lunch break and may even skip out on healthy evening meals due to family obligations and life outside of work. This can have a detrimental effect on their overall health and well-being. Burnout has been known to cause poor patient satisfaction scores and increased infection rates. Patients and families may be less satisfied with care and experience inferior outcomes when nurses experience burnout. Stress can also be perceived by other members of the healthcare team through interpersonal relationships. As a result, this can lead to poor patient outcomes. Burnout may cause nurses to abandon their work situations, leading to increased stress of other nurses. As stress is prolonged, burnout becomes intensified, leading to nurses becoming callous and uncaring towards patients and disgruntled about their work environment. This can have a major effect on patient satisfaction scores. Resiliency is the ability to overcome stress by using external and internal coping strategies. Brown 2018 mentions that high resiliency in nurses is correlated with personality traits of optimism, self-efficacy, hope, and flexibility. In a cross-sectional survey conducted by 2 large acute care university hospitals, the study participants agreed that staff nurses must be stress-resistant and have strong capacity for self-management in order to cope with daily hassles. Stress resistance is important for competent nurses as it is an essential component for patients, nurses themselves, colleagues, and the hospital as a whole. Every effort must be made to develop programs that support nurses with the needed resources and tools to overcome adversity. Nurse leaders should understand the challenge their nurse colleagues face and how to respond to these challenges. Brown 2018 suggests that coping strategies, which are determined by a nurse's level of resiliency, are important for nurses to use in overcoming a stressful environment. It is also important that nurses express the ability to have a sense of hope and meaning. Because of the detrimental effects of burnout, it is critical that healthcare organizations and leaders find ways to support the development of resiliency among nurses. This will lead to a healthy workforce. So why is nurse burnout thought to be a problem, you may ask? Nurses are always venting to each other on both the floor and off on how they feel overworked and underpaid. Care needed for patients is barely met at particularly the facility I work at, as many nurses are having a hard time meeting the demands and often have to sacrifice their breaks and lunches to take care of their patients. It becomes apparent that this is an issue as many of our nurses have resorted to fast food and other unhealthy food choices due to lack of time and energy, as well as adopting smoking as a habit. It is evident that nurse burnout leads to poor outcomes, as there has been a recent increase in medication errors and incompliance following protocol. Our facility has also had several nurses quit as well as be fired due to an inability of keeping up with job demands. Who has control to solve the problem? Management and administrators have control to solve the problem by making sure that we as nurses are adequately staffed and that nurses are getting their much needed and necessary breaks and lunches. Why is it not being addressed currently? Lack of adequate staffing, high job turnover rates within the geriatric nursing field, and nurses with lack of experience make it difficult for this issue to be addressed. Many nurses feel as though they cannot voice concerns due to fear of losing their jobs, and there also tends to be lack of attentive nurse managers. What is the social impact? In speaking with nurse management regarding this issue, it has been noted that several nurses from the past have left due to the inability of meeting job demands and exhibiting symptoms of nurse burnout and fatigue. While many nurse managers are aware of the issue, they fail to acknowledge to what severity it can be and the impact it can have on fellow nurse colleagues. There are several services available to assist in addressing this issue. Mindfulness-based stress reduction training, emotional distancing, conflict training, and event trigger exercises were found to have a positive impact on nurse resiliency. Workshops focusing on these strategies can assist in providing resources and techniques for nurses to implement during stressful situations. Other programs to encourage self-healing and coping include group sessions and individual exercises to develop resiliency, characteristics, and strategies. Implementations by organizational leaders must be made. Such implementations may include written exercises, relaxation techniques, exercise programs, identification of event triggers, and mindfulness training are some strategies used to increase resiliency. Burnout interventions have been shown to improve the physical and mental health of nurses, patient satisfaction, and the organizational bottom line by reducing associated costs of burnout. On-site resources need and must be made available. These include employee assistance programs, pastoral care, counselor or psychologist, psychiatric nurse specialist, and support groups. Lag time between scheduling and these groups must be made available to encourage participation of such interventions. Henry 2014 states that staff retreats have been shown to have a near positive impact on nurses' health and well-being. In a study conducted involving 150 oncology nurses from a large cancer center in eastern United States, it proved that an overnight staff renewal retreat promoted wellness. The retreat promoted engaging staff outside the work setting to relax, have fun, revisit self-care, and reflect and rekindle spirits. Nurses who attended the retreat stated that they were rejuvenated and professionally re-inspired. Despite lack of evaluation tools, the participants acknowledged appreciation for the unique experience of fun personal growth and knowledge. Expressive writing workshops are another great intervention to promote self-care. Journaling was used in a study of 40 nurses. Participants were presented with information on permission, balance, privacy, honesty, silence, attention, structure, and reflection. The presenters had to share their experience with the expressive groups. The authors reported overwhelmingly positive responses from patient group participants and from healthcare providers who used structured journaling. In analyzing the issue regarding the strengths of our facility offers chapel service for any and all staff and residents to participate when needed. Our facility promotes wellness by providing occasional staff lunches, employee appreciation, and Christmas parties. Nurse managers regularly meet with nursing staff to ask them how they are doing and anything they themselves can improve on. Regarding the weaknesses of our facility, there is a high turnover of geriatric nurses. There is a lack of training and allotted time to accomplish tasks. There is poor staffing, frequent call-ins, and large amounts of agency nurses that are used, who tend to be unfamiliar with our job setting. I would suggest that the facility use interviews and regular staff meetings as a means of addressing the issue. It is important that nurses be asked about their own personal well-being and whether anything needs to be done to ensure their own needs are met according to Maslow's hierarchy of needs. Funding for these strategies would come from the facility's aggregate amount that goes towards employee reward programs, appreciations, and staff parties, etc. Management investing in such funding would find it beneficial as it would keep valued employees. This would improve the workforce and strengthen staff morale and well-being. Regarding my recommendations, I feel that each nurse should be evaluated each quarter on their well-being and self-sufficiency at work. They should be assessed and asked questions relating to Maslow's hierarchy of needs. It is essential that their every need be addressed in efforts of avoiding nurse burnout and fatigue. Writing workshops should be utilized as a means of determining the resiliency of each nurse. Once analyzed and addressed, improvements and Administrative staff meetings must be held to prevent burnout from happening. This may include implementing more staff appreciation incentives, improved staffing, and encouraging relaxation techniques and workshops. According to Brown 2018, further research is needed to validate the correlation identified, including resiliency of nurses with children, associate's degrees, and years of experience as a nurse. Resiliency research can help leaders identify the characteristics in new nurses and implement resiliency strategies to maintain a healthy workforce. A comprehensive understanding of nurses' psychosocial work environment is also necessary to respond to complex patient needs. Many nurses express stimulating factors that help to prevent nurse burnout. These include receiving sufficient recognition from patients and colleagues, interdisciplinary collaboration, the challenging work environment, the importance of loving your work and getting social support from colleagues. Nurse managers must be aware and make every effort to support staff nurses in their daily activities in order to facilitate teamwork and collaboration.